Welcome P6. In our previous lesson, we learned about high blood pressure, which is one of the health problems of the circulatory system. High blood pressure is a common condition in which the long-term force of blood against your artery walls is high that it may eventually cause health problems like heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. Now we will be learning about leukemia, which is one of the most common type of cancer in children. All cancers begin in cells of the body, and leukemia is a cancer that begins in blood cells. Normally, cells grow and divide to form new cells as the body needs them. When cells grow old, they die and new cells take their place. Sometimes this process does not work. In cancer, new cells form when the body does not need them, and old cells do not die when they should. Leukemia is a cancer that starts in the bone marrow. The bone marrow is where new blood cells are made. It is a thick, spongy liquid inside your bones. Leukemia starts in early forms of blood cells, usually white blood cells, which help fight infections. When you have leukemia, your body makes too many blood cells and they aren't normal. Leukemia cells do not usually form tumors, but they can travel in the blood and go all over the body. That means they can reach almost any organ. So leukemia can cause problems and be found in many different ways depending on which organs are involved. A person who has leukemia suffers from an abnormal production of white blood cells. From the picture, you can see there the representation of a normal blood compared it to the one with leukemia. When a person has leukemia, the bone marrow does not work properly. The bone marrow produces abnormal immature cells called leukemia cells. These immature cells crowd out other blood-forming cells in the bone marrow. If a child's bone marrow is not able to make enough red blood cells to carry oxygen, the child may develop anemia and feel very tired. If sufficient platelets are not produced, the blood will not clot properly and the child may bleed or bruise easily. When white blood cells are not plentiful enough, the body cannot fight off germs and the child may develop frequent infections. Again, abnormal blood cells do not die when they should. Instead, they accumulate and take up space. Healthy cells have no room to function and grow, and eventually the abnormal cells crowd out the healthy cells in the blood. Leukemia can be either acute or progressing quickly, or chronic, meaning progressing more slowly. Most children have an acute form of leukemia. A risk factor is anything that may increase your chance of having a disease. Anyone can get leukemia. In many people, the cause of their leukemia is not known, but some risk factors for leukemia are known, like family history. Most people who get leukemia might have a family history of it. Radiation exposure. This exposure could be from an atomic bomb blast or a nuclear reactor accident, as well as from radiation therapy to treat another type of cancer. Chemotherapy in the past. A person's risk for leukemia is higher for a number of years after the first cancer is treated. But this small increased risk of getting leukemia later on does not outweigh the need to use these medicines to treat the cancer. Other risk factors include smoking and exposure to certain chemicals. Being exposed to certain chemicals has been linked with some types of leukemia. For example, Exposure to benzene is a risk factor for leukemia. Early symptoms of leukemia are caused by the decrease in the number of mature, functional red blood cells, white blood cells, and platelets. These symptoms can include the following. Blood clotting is poor, meaning there is bleeding and bruising, example, bleeding gums or tiny red spots in the skin. Affected immune system or frequent infections. Anemia, not enough red blood cells to carry oxygen. Weight loss, pain in the bones or joints. Cold sweats, nausea, and vomiting. Nausea is defined as having discomfort in the stomach, usually accompanied by an urge to vomit. Discomfort might include heaviness, tightness, and a feeling of indigestion that doesn't go away. While vomiting is what happens when your body empties its stomach contents through your mouth. These symptoms do not necessarily mean a person has leukemia. Other problems such as infections can cause similar symptoms. If these symptoms are due to leukemia, a blood test would show unusual number of blood cells. Additional tests would confirm the diagnosis. There is no known way to prevent leukemia, but you may lower your risk of developing leukemia by doing the following. 1. Be a non-smoker. 2. Maintain a healthy body weight. 3. Avoid breathing in benzene and formaldehyde. Treatment for leukemia depends on many factors. Your doctor determines your health treatment options based on your age and overall health, the type of leukemia you have, and whether it has spread to other parts of the body, including the central nervous system. Common treatments used to fight leukemia includes chemotherapy and bone marrow transplants. Chemotherapy is the major form of treatment for leukemia. This drug treatment uses chemicals to kill leukemia cells. Depending on the type of leukemia you have, you may receive a single drug or a combination of drugs. These drugs may come in a pill form, or they may be injected directly into the vein. Bone marrow transplants. This is a procedure to replace your diseased bone marrow with a healthy bone marrow.